Let your curiosity rise.
Mad Bricks webcast,
Where the human spirit flies. Mad Bricks webcast. Where the human spirit flies.
Hey, welcome to the Medbix webcast. This is Raman Raju. I'm the host. My co-host, regular co-host, Dr. Susan Davis. I don't know where she is missing in action. We've got to find out what's going on with her later on. But I have my best friend. She's in the beginning of my days of this podcast. She helped me to write a book. My close friend, good friend, Jennifer is the very Jennifer Niemeyer. I don't know what happened to Jennifer, but Jennifer is going to come in the soon. But I hope she is doing fine. Um, yeah, Jennifer. uh, Jennifer, we are missing you. What is happening with your internet is weak? I think someplace is not strong internet.
There's some construction going on in my area, so I'm thinking that might have something to do with it. But how are you, Romana? It's nice to see you.
Good after a long time, it is a very long time. I miss seeing you on the podcast, and we usually get together once in a while. You know that you're busy with your life, I'm busy with my life. As usual. You know, this is the same story of life story. We'll talk with the psychiatrist. She can tell us what the life purpose of life is. So we will. She went through everything, mathematics to physical therapist to the psychiatry. So she knows all of them all together, the broad spectrum, doctor. But so how is you're in Dallas now? Are you joining from Dallas?
I am joining from Dallas, and we're having the heat like half the other part of the nation, so it's very hot here. 106, I think, today. So anyway,
Oh
um,
my
but
God.
I'm glad to jump on tonight with you, and I'm excited to talk to the doctor and hear her. And you always have exciting guests, so I appreciate it, Ramona. It's nice to see you again.
No, your contribution was enormous, Jennifer. You thought this would not have been possible. You were there, in the beginning. I used to freeze in front of in the camera, in front of camera. I went through a long time to learn how to survive in front of camera. It's not easy. But anyway, let me introduce my guest to you, and then I'm going to introduce the our guest. So let me. She has a very great credentials. Today, guest brings a very unusual combination of expertise. Dr. Coleen Schrepfer, MD, is a psychiatrist, is a chief medical officer at Gladstone Psychiatry and Wellness. She is a child and adolescent psychiatrist with experience spanning adult and child mental health, physical rehabilitation, and even neonatal intensive care. That's a very strange combination which she has. Neonatal intensive care. Before medicine, she trained as a physical therapist, earning a master's degree in physical therapy. And before that, that is what my favorite. She studied mathematics. Oh my God, that is my favorite. At the University of Colorado Boulder, she earned her MD from Drexel University. Do you know anything about Drexel? We did a story on Drexel, Jennifer, the first Indian
Mm.
woman who moved to the Women's College of Pennsylvania. That's the Drexel University, actually. She completed a psychiatry in Drexel University psychiatry training and Mount Sinai, very well known, and the University of Maryland. She's a part of right now Shepherd Pratt Medical Maryland Psychiatric Center. Today, her work has a fascinating focus: performance, anxiety in elite athletes, and bringing the physical body into mental health treatment, medicine, psychiatry, physical rehabilitation, mathematics, human performance. What a combination! That is a very rare Medbix combination. That is a very Medbix combination. Sorry, that's a very Medbix combination. Please welcome that Coleen Schrepfer. Welcome, Dr. Schrepfer.
Good
It's hard
evening.
to
Please
find
call me
you.
Colleen. You can call me Colleen.
Uh, Colleen. He's a, you're a little bit of mysterious, and we found you eventually. Mystery solved. Dr. Sheffer, tell me, did I miss anything in your journey? And you can give a fill the gaps. If I miss anything there.
No, I think I pursued things that were interested to me, and I kind of paid attention to things that were happening around me, and I was okay to switch and move and shift, and actually came to a place now that I say, well, all of those other missteps led me here, and I'm very grateful for where I am in this journey of continuing to learn and continuing to help the adolescent population, which is where my heart is and has always been since I first started pursuing medicine as a pediatric PT. So it's been a wonderful journey, and it's still going.
I wanted. I'm from. This is live from Silicon Valley. I'm going to bring Jennifer in a minute, but I wanted to have a question for you. Silicon Valley is a center of epicenter of technology, right? So, do you see quite a bit of this? Even I am trained in technology. I'm very good in it. It is a pressure that mounting on us, on humans, is unbelievable. I get frustrated sometimes. Think about people who are not even exposed to the computers, the frustration they go through. That do you psychiatrists see these kids that checking the phones? They don't even know the relationships anymore. Do you see some big influence as a psychiatrist? Do you ring some warning bells for this kind of a situation there? I want to get your opinion on that.
Oh, 100%. I think the data is very clear and became very pronounced post COVID when there was an increased reliance on technology, even for education. And if we're speaking about the child adolescent population, which is the focus of today's talk, that there was reliance on having this idea of technology and communication. And it's turned out that a lot of social media and video games has led to this contraction where kids are interacting less, having conversations less, relying on the reward system that's set up with how games are and social media to bring them joy instead of having conversations and being out in public and putting their phones down. And we've seen, certainly even with fMRIs, where kind of cortical thickness of adolescents now is thinner than it was in adolescence 20 years ago. And there's a direct relationship between reliance on phones, on technology to even generate answers and to generate solutions to things. So there's less complexity with how youth are approaching problem solving. And what we're talking about today are athletes, and that is completely opposite. That's where kids are engaging in sport and putting their phone down and having this relationship with others around them to become something bigger than themselves. And I am an enormous fan of sport, largely because it reduces that downtime where kids have a tendency to maybe go to their phone or go to video games and have this organized purpose of going somewhere and engaging.
Jennifer, do you have two children like me? And you know the process, and take care of mother, sister. You're superhero in my view. Tell me, what is that pressure? How the pressure of the kids nowadays and the pressure people like you, taking care of the elder care, all those things. How do you manage that? And I ask Dr. Sheffer can answer some of the questions for you if you have any questions.
Great question. I mean, I had to get stronger glasses because of it. Stronger eyes. No, but I think it is really important. It was hard to manage kids because my kids were young when all of this was becoming a thing, and putting your phone down and doing sports, having them be in a lot of sports and doing those activities kind of kept them away from that realm. So they do spend less time than I think other children do for my personal experience. But it's pretty prevalent in the news right now today with the Meta lawsuit and all of those things, it's kind of come around again as the topic of conversation. It is, I do see actually the lack of ability to communicate. And sometimes it comes across as rude. And I don't know that it's rude. I think it's just the lack of knowing how to communicate, because there's an actual human in front of you who can respond, as opposed to now AI or things like that. So I think it's a growing concern. And yeah, put your phones down. That's, I mean, it sounds simple, but it's not. I mean, adults have a hard time doing it. Even walking away, for a vacation, or in church, I see people with their phones. So it's kind of, you got to get yourself some boundaries, I think.
Please, I'm sorry. I didn't mean to interrupt.
No, you go ahead. I don't
No,
really have a
go.
question. I just think it's really prevalent right now. And I think this, just listening to the news a half an hour ago about the lawsuit that's going on right now, about how you keep children engaged. It's hard enough to keep children engaged at the dinner table to eat all the things that you make for them to have for dinner, let alone get them ready for bed and those kinds of things. And how do you manage all of that? I think is really tough. And I don't know that you can do it without, the assistance of some psychiatric help, and, really trying to plug into those things, because you think you know it yourself and you don't. So I think it's getting help and making it prevalent for everybody and very accessible. So having that information really out there all the time, I think, is really important.
I think schools are recognizing it now. There's a trend of pulling away the iPads, of having phones not available, not in school. You're not allowed to bring them anymore. That the old ways of connecting with your parents, if you need to, a phone call can be made by the nurse or the administrator. And they're also finding that having pencil and paper is actually enhancing the ability to kind of integrate information into the hippocampus and to retain memory. So that's happening. I will tell you another trend that has been concerning for me in working with patients is, I'll tell you, patients will say they don't tolerate quiet time alone without their phone. There's this idea of doing everything you can to avoid boredom. So instead of sitting, looking at the leaves, looking at the light coming through, watching the dog run around, they can't just sit there and kind of observe what's happening in the present and be mindful. They can't do it. And they reach right for their phone because they need that constant input instead of generating responses their own. So
I agree
So,
100%. I do have one other comment on that, Ramona, though, really quick, is, for example, I am really close to a nature preserve. So it has some fantastic walking trails. What I do notice is 1 out of 5 have their phones and have ear pieces in. So I feel they're half enjoying the nature preserve. So kind of a part of that, and it's mostly adults, and it's just the moment of just listening to whatever is in the nature, whatever the sound, it's always different. And so I think you miss that, and you don't have time to think when you are constantly engaged. And children would be the exact same way.
yeah.
Dr. Schrepfer, but just adding to the Jennifer's question is, are you as a society of pediatrics, are you raising concerns at the national health level, national mental health level? Advocacy is there. This is a very dangerous levels we are reaching into for the children of our next generation. Is there any advocacy going on, or just let it the future decide and let it go run this wild? Is there any problems that you're trying to, as a as a psychiatrist, as a society, that you're really raising alarms at this national level and come up with a strategy to do? These technology companies are wild. They don't have any boundaries. They don't care about boundaries. They want to care about profits. That's all they are, honestly. So that's why Jennifer is talking about the lawsuit in Meta. because they have unlicensed. This is a control on humans. There is nothing you can do about it. That is the situation we are in. What is our advocacy is doing is, you think you need a advocacy, very strong advocacy from psychiatric group like you.
So I can't tell you about what advocacy is happening at this point. I will say the data's out there. They're doing the basic benchmark research now, even what's happening structurally with the brain, and that data is there. And the American Pediatric Association has recommendations for how to limit phone use. But really it comes down to the parents. Like, parents know the data is there. Create those boundaries for your children. Put those limitations on and create opportunities for your children to not have to rely on that. And it does demand parents and family members to be more present, but that's where the grassroots has to happen. But certainly, even at the larger level, there are conversations happening in Congress and have been. But again, I couldn't tell you what are the strongest advocacy pushes going on right now.
Well, very good. So, Jennifer, go ahead and ask any if anything that Let us before I get into the physical therapy part of the exercise. What important? I have a lot of friends. I spent a lot of time in Atlanta, Georgia. I had a lot of basketball friends. Dominic Wilkins is a very close friend of mine, and
Oh,
he was, and then I used to go to, but his discipline is very interesting. They are very disciplined. Very. I was surprised how disciplined they are. I never seen them. They got other problems, but the discipline-wise, certain areas I really admired about the condition of the body and all those things, mental condition. Mental balance is very thing. One thing I observed with all these people, some of them are real, particularly athletes. They have a really good mental balance than entertainers. I observed it. So because in Atlanta we have a combination of athletes and entertainers. So I
yes.
seen both that difference. What do you think that the athletes have that ability to the performance and the mental health? What is the connection there?
Well, it really ranges. I mean, if you look at the number, I want to say the numbers are about 8 million students in high school who are playing sports in high school. And so the propensity to become a professional athlete, I mean, you're looking at 0.03% of NBA
Mm.
players are, kind of get to the point of NBA. I think baseball is like 0.6%. So there's a wide range there, but that's a small percentage of people in high school who actually make it to the pros. And what the mental piece is probably one of the biggest parts that differentiate those at that higher tier who actually make it to that threshold and those who don't. But that's not inherent. That mental piece, that mental toughness, the resilience, the self-concept, the ability to kind of persevere when you don't want to exercise, when you can't negotiate with yourself, and you go do the work you need to do. What is it about that? Part of it is probably the support they got from their parents, the coaching that they received, the passion behind the sport. So genetically, just because you have the stature you have and the strength doesn't necessarily mean that you're going to get to that higher level. So you're right, the mental piece is an important part of being able to differentiate yourself to become a D1, D3 athlete and then pros. Um, it's this idea of, as an athlete or anyone, kind of genetics gives you the cards to play, but the hand that you actually play depends on so many things of the coaching and the training you got, but also the mental piece and the mental toughness that got you through all of the bumps and the hills and the valleys, because no one does this trajectory.
Let me ask Jennifer. You can jump in anytime you want. You're free. This is your channel too. Um, when is the performance anxiety? For example, there is a game coming up. My son is actually a football player, and he's a neuroscientist, or he's a neuroscience graduate. You know, the performance anxiety, eventually sometimes it can turn into the mental anxiety. Where is that boundary? Do you know the boundary between those two? Can you explain a little bit boundary, that where do you, when do you find out is a normal anxiety versus is a it became a clinical anxiety for the athletes at least?
Yes, and it certainly is a continuum. I would say for every athlete, having that pre-performance sympathetic rush where your heart rate goes up and your a cognitive attuneness is higher and your skeletal muscles are more perfused because you're getting increased blood flow to the peripheral tissues and you're ready to perform. You're ready to get on the court, to get on the field, to jump off the platform and do your swim. That's important, and that's something that really kind of sets someone up to be able to explode, kind of that fight or flight. Let's go. That's an important piece, and that's normal. It's when the anxiety goes during the sport or during the performance goes into where you're here too much, the overanalyzing, the overthinking, the pressure to get the result you need instead of going in the flow, relaxing and trusting the practice that you did day after day leading up to the event and getting to the point where that mental rigidity and the worry and the negative fear, the worry that you're not going to do the flip turn right, the worry that you're going to lose your first serve percentage, the worry that you're going to miss the pass or not do the right defensive play, that translates, that negative thought concept then translates into motor rigidity, and you lose some of the motor patterns that you've developed during practices. So that's one element of anxiety becoming problematic. And that can be addressed without a doubt with working with a therapist, a psychologist who can help you understand where some of the negative thoughts are coming from, why you're getting stuck on that, and to help you let things go. Again, like I said, trust the process, trust the work that you've invested in all of the practices leading up to it. But then there's the other tail end of it, which is when that anxiety that you're carrying, potentially related to your sport or potentially being there anyway, that level of anxiety that you have more clinically, that's more diagnosable, that is just potentially exacerbated by sport. And that's when you need much more support from potentially working with a psychiatrist, working with a nurse practitioner who can really tease out, is this something that needs medication? Is this something that needs treatment beyond working directly with a therapist? And I will say most athletes are, even high school, even middle school level, really want to perform well. They want to do well. Most hopefully are doing a sport they're passionate about. The challenge is that when anxiety is there and it's getting to the point where it's creating it difficult for the athlete to actually perform the task well and to do well and leads to a worse performance, is that they don't talk about their anxiety. The athlete doesn't want their coach to know that they're struggling. They don't want their coach to know that they're not all in and ready to go, because there's this fear in the back of their mind that if I let my coach know that I'm struggling a little bit, then maybe the coach won't pay attention to me as much. Maybe the coach won't put me in his first string. Maybe the coach is not going to support me in this. And so I'm going to cover it. I'm going to mask it and I'm not going to say anything. And then that anxiety that is there and under addressed actually can lead to depression. So,
That's a question.
yeah. Oh,
That
so we
question,
look.
that's a very good point you made. That question raises that, don't you think coaches themselves need some training into how to deal with this kind of things on the
Yes.
psychology and mental side, mental health side?
I think some coaches are very aware of the impact they have on their students and their athletes. The data shows that when a child has secure attachments with this idea of caregivers who are taking care of me, and there's a reliance on them and extended family, that's important for the child to be able to develop this sense of safety and security. But having a relationship outside of that family domain, which can be a religious figure, it can be a musical coach or a dance teacher, but largely it's coaches, that when that coach relationship is there, it is incredibly important for the development of that child's sense of self and security and ego identity and independence. And when that relationship with the coach and the student is not optimal, when the coach is not incredibly supportive and recognizing how to support a student in a positive way and is punitive and demonstrative, it really can disrupt a student's self perspective and can be very damaging. So yes, the relationship of the coach and the athlete is incredibly important and is formative for this child and this adolescent. And unfortunately, not every coach is aware of the power that they have with that, and it can be very disruptive.
Jennifer, I don't know.
COVID, it's like you have all these fingers pointing into the same thing, where you really probably have anxiety, but you don't know it, and you haven't put your finger on it, or you haven't taken a moment to think about, do I have that? What am I? I'm just going through the motions of every single day, pushing my kids or not pushing them, or trying to keep them entertained while I'm busy doing something else. How do you manage that? And is that different now from 20 years ago? And will we look at it different in 20 years as we are right now?
Excellent question. Dr. Schrepfer, the ball is in your court now to the societal problem solving.
Well,
Problem solving, I guess.
so in terms of thinking about what you first mentioned, is that when a parent is anxious, kids pick up on that. And I would say 100%. So a child is very adept at, no matter what age. I would say even a toddler and an infant is aware of that stress level. So when a child, adolescent, sees that with the parents, what is helpful is that the child sees that, yes, mom can be sad, mom can be anxious, mom can be depressed, but having the conversations about that, and having the conversations about, I'm feeling this way, and these are the things that I can do. Can you help? Can you be a part of this family and help out with roles, functional roles, to help take care of the elderly grandparent if they're also living in the home? I will say one element of wellness, and I talk about this with my patients all the time. I talk about, there's a pie and there's slices to the pie, and the slices of wellness are sleeping well and eating well and having function and exercising and taking walks in the woods and having meaningful relationships. But one slice of the pie, Jennifer dropped off. One other slice of the pie is function and doing something for someone else and having a purpose greater than yourself. And so having our children be involved in the family structure and function and playing roles is really valuable for their sense of self-worth, but it also integrates them into the woven fabric of
That's a very good point.
larger
Jennifer,
generation as a whole. It was, incorporating I'm kind of getting close to that generation now, where my youngest is 13 and I have a 23-year-old, and my parents are getting to that place, and we are very often involved together, and my youngest is involved with my parents. So incorporating that, but
Jennifer,
and sharing your emotions and being honest with them, but also explaining the story behind that makes it much more understandable for the child. Because honestly, what happens with so many children is, if they see, and it depends on the developmental age, but when children see parents upset, guess what? Immediately they're like, I did something wrong. It's me. Mom's upset because of me. Things aren't right in the family because of me. They do take the responsibility. So if there is discussion about what's happening in the household, and it takes some of the worry off of them. It's also modeling for, I can be sad, but I can also do things to help myself be okay. And it's okay to have the range of emotions. We don't have
Yeah.
to be neutral and happy all the time. We can be sad, we can be anxious, we can be worried, and we can be on the other swing, happy and sad and all of that mixed in. And it's okay to feel the feelings. So I think that's a very natural, wonderful, beautiful way to share that with family.
Dr. Shepherd, he said that very interesting thing, conversation. I had a friend, psychiatric friend, Dr. Arsha Wahab. He trained in Emory and then he moved on to the Boston. Very good friend of mine. He was a psychiatry association also, to some extent. He told me talk therapy, talking is such a powerful weapon in treating a lot of mental health conditions. I was surprised in the beginning. I thought, I always thought, said therapists talk cuckoo stuff. Or it's a very different understanding I had. And after that, I changed my mind how much they talk. And, if medicines can affect the entire brain, but talking is exactly, if somebody says you're a bad person, it affects that particular part that only can be resolved through the conversations. Do you agree with that? Is it interesting? You're talking about conversation.
Oh, incredible. Therapy is incredibly important. And many times when I evaluate a child or adolescent, that's the first thing that I recommend. Not always, because there are sometimes where medications are equally important. And again, lifestyle things too. I talk about the pie, and there are many things that I recommend beyond medications and therapy, and thinking about the whole person and what other things are missing in their life, and how can they empower themselves and bring some lifestyle changes in to augment. But yes, talk therapy is incredibly important. The data is very, very clear. There is an element of when someone has a mixture of emotions and circumstances, but once they formulate it into a conversation, it organizes it and it stratifies it for that person who's engaging with the therapist. And having the discussion and talking about things is certainly a way for that person to organize it in their mind, but it's also an exposure. When you share it with someone, you're exposing yourself to retelling that story and sharing it with someone who is a therapeutic listener, where you have a therapeutic relationship with and trust, and that person receives that therapist. There is just another level of healing. There are some studies that have looked at therapists who have practiced for decades and have maybe read every article and done a lot of research, and therapists who are brand new. And really the power of that relationship between the therapist and the patient is defined by that therapeutic alliance, which may not be the person who's worked for 30 years and had a ton of clinical experience to bring to the table. So there is also something about the dynamic between two people that is important. And sometimes it's a hit, and the first therapist you work with really is the right person, and sometimes you have to make a change, and that's okay.
Jennifer, so you tell me that what you were frozen before. Just she was saying that when you are dealing with the children and your elderly care and sister, so conversation is a powerful weapon. As a converse with your children and tell your problems. Don't hide it. I think that's what she meant. I hope I'm communicating it right. I'm not a doctor, but she is a doctor and she can communicate. That's what she's saying. What do you think? Communicating with your children is the primary, it's a way of reducing that kind of a friction, I think. What do you think, Jennifer?
Oh, yeah, I agree 100%. My personal experience is, you know, your kids only know what you let them perceive you to know. And if they think you're happy all the time and they don't know that all these other things are going on or pressing or of concern, and all you say is no, or we can't afford that, or we can't do that, or you can't go there, all of those no's, that builds up without them knowing what's really going on. You can be in
Yeah.
a relationship and it can act like everything is fine all the time, and then the relationship breaks, the parents split up, and the kids are like, "I never saw you fight." So there's that kind of piece of it too, where they were caught off guard. And I mean, I suppose there's some things that kids don't need to know everything, but I think you're right. If they are exposed to knowing that you can be happy and sad, that's a good way to have a boundary, and they can learn how to be happy and sad, and not then act out in anger, or use their phone or other, social media to make those things, and or other terrible things that they turn to, that is,
Yes.
negative.
Dr. Schaefer, Elon Musk made ketamine therapy very central point there. He was a ketamine. What? Tell me about the ketamine therapy. Is it powerful? Where do you use? When do you use it? Is a particular people are qualified for that? What is the esketamine? There's a lot of different forms of ketamine there. So what is the ketamine therapy, and who are the patients? How do you select them for the therapy?
So ketamine has been used for over 40, maybe 50 years, and it was first used in surgery. It was used as anesthesiologists were using it prior to surgery. And what they found is patients after their surgery would come in and say, you know what, after my procedure, I felt really lighthearted. I felt happy. I wasn't as sad. I could concentrate on things. My sleep was a little bit better. And so with that, they were trying to explore, well, is this because of the ketamine? And so they did a number of studies and actually found that ketamine was a very powerful antidepressant. And it was approved, I want to say in 2016 or 17, to be used for treatment-resistant depression. And ketamine now is used with a lot of different forms of delivery. There's IV, IM, there's nasal, which is the S-ketamine, and then also troches to buccal absorption. And essentially what ketamine does is it really creates this neuroplastic framework. It stimulates neurons in a certain way that allows for new branching, dendritic branching, neurons to kind of connect in new ways. And one colleague kind of explains it like you think about a ski slope and you've got these pathways, and when it snows, it kind of creates a new surface. And with that new surface creates an opportunity for a different way to go down the mountain. Even though those main pathways are still there, the brain, the cortex is still there, but the snow that lays down allows for a different way to traverse the mountain. And so with ketamine itself, there are centers that use ketamine only, and there's still powerful neuroplasticity that happens with that. There are neuroplastic changes that happen, and with that leads to less depression. It's very clear. What studies have shown is that when you have the foundation of using ketamine that creates this neuroplastic, again, a brain that is ripe for change and for new neuronal connections, that when you pair it with intensive psychotherapy that is very specific, and the therapy is done by therapists who have very specific training in ways to facilitate patients in understanding what their experiences are when they're in a psychedelic or psycholytic experience with ketamine, depending on how much or the quantity that's used. But with the therapy, then the changes that are initiated with the medicine are really cemented with the work that you're doing in therapy, and you're understanding where the trauma is, able to talk about things and explore things without having the emotional centers kick in and prevent further exploration, which is what happens with trauma. When you experience something, whether it's in childhood or adulthood, those memories are imprinted and very rigid. And it's very difficult sometimes to talk about, which is what therapy is. Trauma therapy is to get to the place where you can talk about the trauma. Again, we talk about talk therapy and the importance of it. And the more you talk about it, the less the amygdala, which is the stress center, is associated with those memories. And so then the trauma takes on a different physiological process where it's not threatening anymore, and you're not in this fight or flight mode, and you can re-talk and re-experience the trauma without those triggers. But what ketamine does is it really facilitates the work with the therapist to even get to that place of healing even faster. Um, and there are lots of different protocols about ketamine and how frequent you should be getting it, and booster sessions and all of that. And certainly in the near horizon are other experiential medicines, psilocybin and other things that I think
Oh, yeah.
what yeah.
I
There's been
wanted to
talk
get into that actually. I want to
about
ask you. I wanted before John Hopkins does it close to your place. Before I get into
yeah.
psychedelics, I wanted to ask you about the ketamine addiction. Matthew Perry, is one of the famous actor, died. Ketamine addiction is a bigger challenge. How do you prevent that becomes an addiction? It is a fine line between the addiction and the real mental therapy. How do you handle that?
Well, that's why it's important to actually go to a center where there are psychiatrists and nurse practitioners who are monitoring someone. Well, first off, doing a very clear medical assessment to make sure that someone is able to take this medicine, whether there are cardiovascular risk factors with high blood pressure and other medical conditions that need to be screened. And addictions is one of them. So having that medical assessment, having that thorough therapy assessment is really important. But going to a center, that's why it's important, because you're working with nurse practitioners and psychiatrists who are really monitoring patients, not just physiologically, but also emotionally, and seeing patients week after week over many month period. And so keeping an eye on patients, and that's why it's important, versus having a mail order ketamine that you do at home. That's where the risk comes from.
Yeah. Now that you just mentioned the psychedelics, let us talk about psychedelics. Johns Hopkins does quite a bit of research on the psychedelics. Are there any one dose psilocybin effect? It is there now with all this technology, with all the pressures of society. As I'm getting older, both you are getting younger other way, but I'm getting older. As I need that we need that kind of a prescription for a psilocybin one time pill that can magically solve the problem, or is it just another story that is?
So there's been an enormous amount of research that actually started in the 70s. And you're right, it was Hopkins and there were a few other medical centers. And the initial research was really surrounding end of life distress. So patients with
Mm.
terminal cancer who were faced with, I have months to live. How do I organize myself? And the distress is so intense. I had a very dear friend who recently died of pancreatic cancer, and it was devastating because it was within a very short period of time that they were diagnosed and passed away. And there was distress in that diagnosis and the fear and all the things that they wanted to do before they passed away. And so the research really started there, and it was dramatic. The significant reduction in depression, panic, severity, of the anxiety and the emotions associated with that type of diagnosis. And it led to patients actually having peaceful last couple of weeks or months. And so that's where the research started. And then it stopped and restarted again, I believe in the mid 80s. And it's been certainly happening overseas more than it has in the United States, but we're hearing discussions that the studies we know are very clear, and that there may be way in the next year where that will be approved, and centers like Gladstone Psychiatry, because we have actually incredible clinicians. We have actually clinicians who were part of the Hopkins studies back in the 70s working for us and helping us design protocols and programs to help patients. So there will be a few centers across the country ready for that when it happens. But it is a very different protocol than ketamine. Each of the different experiential medicines are very different.
Jennifer, this for you. You can reduce that resolution a little bit lower resolution, so your frame will stay calm. That's in the settings wise. You go to settings and but anyway, the one I'm going to talk about is your, in India, we are in the previous days when I was a kid, all of them are joint families. That's a big help to us. Joint families really take care of each other, talking each other. Now you live in kind of a joint family, Jennifer. My sisters and mother and sisters all around you, good and bad. It has its own pressures and it has its own benefits. What is your opinion on that? In general, uh, I'm putting you in the middle of the car, middle of the testing here.
I need to call the doctor.
Yeah.
um, it's just a lot. It's a lot of juggling those things, those emotions, those places. Where are you in life? Where do you go? Is that your purpose? How does that all fit? You try to make everything every day the best, and you try to fit all these things in, and then you have a moment where you're exhausted. I don't know that. I'm not a medication taking person, so I always want to try to find other things to do that makes, hence why, a nature preserve is very important, and not to have headphones in, to really just to be outdoors and experience whatever is happening in nature. I think brings me back personally to a grounding situation. And so I think you have to figure out what works best too for you. And I do truly believe that people really do need therapy, to help with that. I think it's some of us have that we can do everything and I don't need help, is really not true.
Yeah.
Yeah. It's so important what you talk about being outdoors in nature. I mean, the evidence is so clear, which is why lifestyle medicine kind of encompasses so much. But the evidence behind, like, forest bathing, being out, walking out in the forest and breathing in the phytocyanides, and the evidence behind taking in the oils that trees secrete and you breathe them in actually helps to stimulate neurotransmitter availability and leads to a sense of calm, reduces depression and anxiety. But it's also a mindfulness task. When you're walking in a tree, you're walking to make sure you're not stepping in a small hole, and you're paying attention to the squirrel that's running in front of you. Or I was just in Maine. I was scanning to make sure there were no moose around me, right? So it's
Yeah.
a mindful task. And so that's incredibly important. Exercise is incredibly important. The benefits of exercise, of it can be anything. I mean, even if you're 73 years old and have never exercised, the benefits for cognition and mood and blood flow to the brain and memory and alertness, sense of purpose, mindfulness, it is so incredibly important. So that's another piece too. Being by the sea, stopping and literally smelling the roses is very, very important. And finding even the briefest moments to create that space for it truncates the stress and the worry we have. Like, if we can put a pause, stress is inevitable. Everyone will experience it. But if you can put a pause in that stress, then, or take a deep breath, like do diaphragmatic breathing. So it stimulates your vagus nerve and happens to shift you into a place of more parasympathetic calm. Like, all of those things can put pause to the anxiety that you have in the moment. And it's so incredibly helpful because it breaks the buildup. If you can put a pause in that anxiety kind of needs to reset, and it's not building and building and building and building. So even though we would all love to be able to take a 2-week vacation and go to, I don't know, Australia and walk along the beach, we can't. But you can still create those 5 minutes, even for yourself, and ask for that and do that. So I applaud you for creating that for yourself. It's important. And instinctively, you knew. So well done.
Very good. We're coming to end, and I wanted to ask you. My son is a neuroscientist, and he's a musician. He writes music. He produces music. He was telling me that He studied in Vanderbilt, neuroscience. What he was telling me was that music takes you someplace, someplace. It is also stimulates certain environments and take you to the place and time periods. And it is can I think we have not done enough research on it. I think music can play a significant role in the mental well-being. What do you think of it?
Oh, without a doubt. And in fact, in speaking about ketamine assisted psychotherapy, so we talk about set and setting, which is where when someone is coming in for treatment, setting up the right environment, the right room temperature, the right blankets, the right artwork on the wall. Like we will change the artwork depending on what's calming and soothing to a patient. But music is an incredibly important piece of that. So there are playlists that are set up to help patients have them relax and dive more into the experience of their psycholytic or psychedelic experience. But the effects of music are right. You listen to it, you hear the most amazing song and you get goosebumps. Like there's a physiological response that you hear when the harmonies are just right. And there's evidence behind even singing. So when you hum or sing, you stimulate the soft palate of the roof of your mouth, and that actually stimulates your brainstem. And that can help also stimulate some neurotransmitter release and relaxation. So, yes, playing an instrument, hearing music, singing, all of that is very therapeutic, without a doubt. And there's actually music therapy. There are therapists that use music, whether it's playing music and drumming to kind of have a cohesive group and everyone creating those sounds together, or using music to express their experiences. It's used in trauma work often. So yes, incredibly important. And I worked at a children's hospital where children were undergoing very, very intense, frightening, very intrusive procedures. And having a music therapist there in the treatment room made an enormous difference in the kids being able to
Mm.
tolerate and handle the experience. So it is 100% true.
Oh, thank you. That's very good answer. And before we are coming to an end. Actually, I wanted to. Um, One of the things is that as a we are all getting older. The not you or me or anybody, the whole world in the comparison to the previous years getting older all over. China and Japan is one of the number one countries. The older population is exploding, so
Yes.
they see a lot of loneliness and depression and all these things are doing that. How do you manage that, and what is the solutions for that kind of a huge societal problem right there?
Well, the research is really interesting. And then looking at what you guys may have heard of the blue zones. And so looking at
Mm.
pockets of places on the planet where people are living as centurions and beyond and thriving. And what there are certain elements that they've looked at, again, lifestyle medicine, but looking at the nutrition, what foods have they been eating? But really, what is the biggest derivative behind people living and thriving in that centurion zone and beyond are relationships, are having people in their community who they see on a regular basis, they communicate with, they do things with. And so finding ways to have ourselves, when we get to that place, ensure that we have that relationship with people in our community, whether it's a spiritual group or a knitting group or a tennis group or a cooking group, but really make a concerted effort, not just in our older age, but even now, making a concerted effort to find ways to make those groups established and to persist. It's so easy to sit on your couch and say, tomorrow, oh, I'm too tired, I'm going to do it tomorrow. Do it now. Like create those groups now. And that's what we call kind of behavioral activation, which is a term, this idea of like, you know, let's do the movement first and then the motivation will happen afterwards. So patients with depression in particular have a tendency to kind of fall back into recluse and not engaging, not taking care of themselves, sleeping more, being less involved, but that mindset of, okay, I don't have an option. I have to go to church, or I have to go to this geriatric meeting, or I have to go to this cooking group. And then that enhances mood, and that it facilitates connection. And if this idea of, like, when you're little, you want your parents to see you and hear you, everything you do, you look and make sure that they're watching you. Guess what? We need that always. We don't just need that when we're toddlers. We need that when we're older as well. So create the opportunity for that to happen. But Blue Zone research is fascinating, really interesting.
Jennifer, a quick question before we finish. A quick question or comment. You have anything, Jennifer?
Just real quick, this was just a reference specifically to what you just said, behavioral. I was coming out of bringing my disabled sister out of a physical therapy, and it happens to be an outpatient at the hospital. I got on the elevator with two elderly ladies who were having a conversation, and one said to the other, it really took me back. One said to the other, "This is the only social event I have. So coming to physical therapy." The other woman said, "You're exactly right. That is the same for me." So their only engagement, social activity, is coming to physical therapy as outpatient in the hospital. My heart felt sad for that.
Yep. My immediate response was this when you mentioned it. Yeah.
So I
I'm
just
just
communication. We should really take more care into our neighbors and all of those things. And I just think we get wrapped up in our own lives and we forget about what really is important.
Absolutely.
yeah, Dr. Coleen Schrepfer, thank you so much. You spread so many subjects you touched on, touched upon.
I know we were
It's
talking
absolute-
about athletes. That's what I thought today was about. And we talked about
you,
so
you
many
touch a lot of
things. Maybe
you
I could
touch a
come back
lot.
another time and talk about
Yeah,
athletes. So.
but we need all the, as a mind spectrum, mental spectrum is a big, large, so we can talk about everything. And you
It
answer,
is.
you shed a light on all of them. Thank you so much for joining with us. It's a truly an honor and privilege to have you here. So stay on a couple of minutes, and then I want to talk with you about a little bit other things. Stay, Jennifer. Thank you all. Good night. Thank you for joining. It's
It was
truly
nice
an honor.
meeting you, Jennifer.